Hello and welcome to Medical Surgical Series. In this series here, we'll be looking at musculoskeletal disorders. And before we proceed at looking at some of the top 10 musculoskeletal disorders, we have to look at the review of the musculoskeletal system. So, musculoskeletal system is a true testament of the nature's craftsmanship. Okay, it helps us with both the structure and mobility, and thus enables us to stand, perform daily activities, and perform a myriad of physical pursuits that normally define our lives. So the major components include number one, the bones, which formed the structural fold. So it's a framework that consists of bones. So our skeletal serves as the body's architectural scaffold that offers support, protection, and a reservoir for essential minerals. So the bones, we have the axial skeletal that consists of the 80 bones and the appendicular skeleton that consists of the 126 bones. Together, they make 206 bones in an adult skeleton. So the exoskeleton comprises of the central axis of our body and includes the skull, vertebral column, rib cage. So the skull shields the brain, the vertebral column safeguards the spinal cord, and the rib cage envelopes and protects vital organs such as the heart and the lungs. On the other hand, appendicular skeleton extends outward from the axial skeletal, and it includes the limbs and associated girdles. We have the pelvic and the pectoral girdle. Remember, it forms the basis for locomotion and manual dexterity. From the bones, we look at the muscles, and the muscles we normally term them as the engines of motions. We have over 600 muscles, close to 640 bones. Okay, so a link will be popping up on the 640 bones of the human body. Remember, these are engines that power every move. So muscles are there in three types. We have number one, we have the skeletal muscles, which are the main one, and they are the voluntary muscles that are normally attached to the bones and by the tendons. So they allow us to consciously control movement from the simplest gestures to the most complex athletic feats. Okay, so they are voluntary. Okay, we use them consciously, but we could have exceptions of muscles that we can use and voluntary, like the diaphragm muscles, which is involved in controlling breathing. We have the smooth muscles, and these are found in several organs. So within their walls, like the stomach, we have the intestines. Remember, they contract involuntarily to facilitate processes such as digestion and digestion. The last group of muscles, you have the cardiac muscles, and these are uniquely located in the heart, and they work tirelessly to maintain rhythm and ensuring you have continuous circulation of blood throughout the body. From looking at the bones, looking at the muscles, we look at now the tendons, which we refer to them as the connective link. So tendons are tough, fibrous bands that connect muscles to bones. So they are essential in transmitting the energy generated by the muscle contraction to the bones, thus facilitating movements. Remember, tendons are very critical in everyday activities, from the most delicate finger movements to powerful leg strides. The tendons will be highly involved. The last group of the major groups is the leg ligaments, and these are the stabilizers and the limiters. Okay, they limit, they stabilize. So ligaments are strong bands of connective tissue that connect bone to bone. Okay, bone to bone ligament, whereas bone to a muscle, we have the tendons. They help in stabilizing joints and preventing excessive movement. They play a pivotal role in maintaining joint integrity and protecting against injuries such as sprains. Okay, so sprains will be related to the ligaments, whereas the strains will be related to the tendons and muscles. Okay, so we have some of the top 10 musculoskeletal disorders, and these musculoskeletal disorders are going to be affecting the muscles that you have mentioned, the bones, the joints, ligaments, and tendons. So these disorders can result from various causes, including trauma. You could just be having inflammation, infection, or degenerative changes. Okay, so um, when these conditions occur, we are going to have the priority nursing diagnosis that you're going to take the patient through. And um, one of the most common nursing diagnoses is pain related to the musculoskeletal disorders. And here we have pain management is often a top priority to assess. You need to assess the location, the intensity, the duration of the pain to determine the appropriate intervention. Remember, a link will be popping up on how to generate or create or write a nursing diagnosis, okay? And we insist on the three-part nursing diagnosis that we are going to be writing. So here is just like the stem that you're going to have, the acute pain related to musculoskeletal disorders, or could having impaired physical mobility, and you find that musculoskeletal disorders restrict a patient's ability to move, which can lead to muscle weakness and contractures. So nursing intervention should focus on maintaining and improving mobility. You also have the risk for falls and risk for infection. So these are some of the four major nursing diagnoses that are going to affect patients with musculoskeletal disorders. So we're going to have do some tests, the general test for all the musculoskeletal disorders, if not most. And it's good for us to know one of the common tests that is normally done is the X-ray. And X-rays are commonly used to assess bone structure. So findings could include someone confirming that someone has a fracture, someone has a dislocation, or someone has a degenerative change, like for the example of the osteoarthritis. Another second one is the MRI, magnetic resonance imaging. This one provides a detailed images of soft tissues, including the muscles, ligaments, and tendon. It's very helpful in diagnosing conditions like herniated discs, ligament tears, and soft tissue tumors. The third one is CT scan or computed tomography. So this is computed tomography provides detailed cross-sectional images of the bone and surrounding tissues. They are useful in evaluating complex fractures and assessing bone density. We'll also be performing blood tests, and these blood tests could include such as the ESR, erythrocyte sedimentation rate. This is non-specific. It shows this inflammation, but it's non-specific. Okay, it's not precise to one end. We also have the C-reactive proteins. Okay, they can also detect inflammation in musculoskeletal disorders like in rheumatoid arthritis. Also, another test we have ultrasound, and this is often used to evaluate soft tissues such as tendonitis or muscle tears. It can also guide in injection for pain relief. We have another test called bone densitometry, okay, DEXA scan. So DEXA scan measures bone density and are crucial in diagnosing osteoporosis, which is a very common musculoskeletal disorders in the elderly, okay, especially the post-menopausal women. We also have arthroscopy, and this is a minimally invasive procedure in which small camera is inserted in a joint just to visualize and diagnose conditions like meniscal tears and cartilage. Remember, arthrosis is a joint, so arthroscopy, a joint, okay? Arthrosis, joint. Great. So, what are some of the common musculoskeletal disorders that we are going to encounter? Well, we're going to mention just like 20. So the one of the most common one is osteoarthritis. This one is a degenerative disease characterized by breakdown of the cartilage. The priority nursing diagnosis will include here pain management and impaired tissue mobility. Diagnostic tests that will be implicated here will be the X-rays and the clinical evaluation. We have number 2, rheumatoid arthritis, which is an autoimmune disorder causing joint inflammation and deformity. Nursing intervention will include the pain management and promoting function, and the test will be related to the ESR and CRP just to help diagnose the inflammation aspect. Remember, a link will be popping up to show the differences between osteoarthritis and rheumatoid arthritis. We have another condition, we have fractures, so broken bones due to trauma or weakness, or even old age, okay, aging, okay, correct. We have osteoporosis, then we have tendonitis, we have ligament sprains, okay. Remember here we're going to be having sprains, whereas in tendons we'll be having strain. Also, a link will be popping up on the 10 differences between strains and sprains. We also have herniated discs or the slip disc. This is the protrusion of the spinal disc soft interior, and the priority nursing diagnosis here will still be pain management and education on proper body mechanics. MRI is commonly used for making such a diagnosis. Also, we have carpal tunnel syndrome, compression of the median nerve in the wrist, and the priority here again will be about pain management and splinting. We have another one, gout. Okay, it's a form of arthritis that is caused by uric acid crystals in joints, and pain management will be one of the major priority and majorly affects the alcoholics in this case here. We have fibromyalgia. This is a chronic pain disorder with widespread muscle pain. Okay, priority will include pain management and pain management for that. Scoliosis is the next one. Is abnormal curvature of the spine. We have 5 major abnormal curvatures of the spine. A link will be popping up. You can review the 5, but this one is one of the most that is involved in musculoskeletal disorders. Then we have ankylosing spondylitis, and this is an inflammatory arthritis primarily affecting the spine. Nursing diagnosis will still include the pain. Then you have torn meniscus, a common knee injury involving cartilage tears. We have tennis elbow or lateral epicondylitis, inflammation of the forearm tendons. Then you have frozen shoulder or adhesive capsulitis, stiffness and pain in the shoulder joint. We have plantar fasciitis, inflammation of the plantar fascia in the foot. Then you have bursitis, inflammation of the fluid field near the joints. The ganglion cysts, okay. Guys, we can review the different types of cysts. A link will be popping up. You can look at the different type of cysts. But for this ganglion cyst, this is an uncancerous lump that commonly forms along tendons. Then we have Musculoskeletal disease, a common cause of knee problem in adolescents. Okay. Lastly, we have Paget disease, and Paget disease is a chronic bone disorder characterized by abnormal bone growth. Okay, so nursing priorities will include pain management and monitoring for complication, and can be diagnosed through X-ray and body tests. So those are the different types of musculoskeletal disorders, the ones that we are going to cover in this topic, and we can start learning even from now. Okay, starting with the differences between rheumatoid arthritis and osteoarthritis. Thank you so much and have a great time.